Hey everybody, this is a bonus episode. Last time on a Morel Dilemma, you heard from Dr. Michael Ye, one of the CDC investigators brought in to help with this outbreak. And it took 8 months to make that conversation happen. When it finally did, I will be honest, I had a hard time holding back. I am pretty clearly a big nerd when it comes to this stuff, so once I had him on the line, we covered a lot. Honestly, it was heartbreaking to cut most of it out, because it didn't serve the Bozeman story. But a big part of this series is pulling back the curtain on the public health systems that quietly step in when something like a mass poisoning happens. So today, we're going behind the scenes to hear about how you train to work at the CDC, how they get pulled into investigations like this, the kinds of outbreaks the CDC has been involved in, and a recent mushroom poisoning outbreak they helped investigate, but not the one you're thinking of. So this is a deeper dive, a longer conversation with Dr. Ye, and a chance to hear what the processes actually look like when you try to contact the CDC and once they become involved. So let's get into it.
So I'm Michael Ye. I am a medical toxicology physician here at CDC's National Center for Environmental Health. My medical training included a combined internal medicine and emergency medicine residency, and then after spending a few years practicing emergency medicine in community settings, I went back for a fellowship in medical toxicology. So when I finished fellowship, I joined the National Center for Environmental Health, where I work as a medical officer. So my team here at NCEH investigates outbreaks of illness that may be caused by toxic substances, both here in the United States and around the world. So these can include environmental and chemical exposures from contaminated food, medicine, dietary supplements, as well as other routes of exposure, including contaminated water and air, and environmental pollutants.
So you work at the National Center for Environmental Health at the CDC, and you mentioned a couple of different types of outbreaks. What outbreaks has your unit helped be involved in the past?
So, for example, most recently, we have been involved with several investigations involving food products. In October 2023, we investigated lead exposures among children who ate cinnamon and applesauce. It was our colleagues at the North Carolina State Health Department who were really astute, and they noticed that there were some kids in their state with high blood lead levels that were initially a bit of a mystery. They didn't seem to have the usual exposures that you think of, like lead paint chips, but they noticed
Right.
that these kids all ate the same brand of applesauce pouches. From that investigation, we found out that an applesauce was contaminated with lead and chromium. And this applesauce was produced in Ecuador, and just a cinnamon flavored applesauce that was contaminated. The cinnamon was actually from Sri Lanka. And interestingly, when FDA tested the cinnamon, they did not find lead and chromium in the whole cinnamon sticks, but they were ground and processed at a facility in Ecuador. And somewhere along that process, the presumed lead chromate appeared.
Wow.
So
So
we're
the
not.
U.S. CDC was involved in this outbreak of lead poisoning in applesauce because kids in North Carolina were showing up with lead poisoning from unexplained sources. Somehow somebody narrowed in that they all ate the same applesauce, and the U.S. went to the facility to basically do a track and trace and figure out where this was being introduced. And
Well, yeah, that was basically FDA. FDA
FDA.
took the lead on investigating the product. So typically, what
Yeah.
happens with outbreaks like this is FDA would investigate the foods or other products. We at CDC would focus on identifying cases among people who are exposed. We would handle more of the human side of things, the
Yeah.
epidemiologic investigation. And when I say we investigate these outbreaks, we don't necessarily deploy to the field every time. Sometimes we do, but sometimes we also provide technical assistance from here in Atlanta, and we assist local and state health department in these investigations. So CDC over the years has played key roles in many high-profile investigations that have since made their way into the medical and clinical toxicology textbooks and curricula. So some well-known examples include synthetic cannabinoids contaminated with the long-acting anticoagulant rotificum occurring across multiple states in the US. Back in 2015, there was a mass poisoning at a funeral in Mozambique caused by pancreatic acid that was found in a traditional fermented alcoholic beverage made of maize called pombe. You might have also learned about hypoglycemia being associated with children who ate lychee fruit in northern India. So one of our former Emory CDC Tox fellows was also deployed to India to investigate that. Our team also investigated acute liver injury associated with pyrrolizidine alkaloids in Ethiopia and liver injury caused by aflatoxin in Kenya.
These are the kinds of outbreaks I've only ever read about in textbooks, so hearing it firsthand, it's different. Although some of these outbreaks I've had more than just textbook experience with. And in fact, Dr. Ye and I almost crossed paths in one of them.
You might also remember back in 2019, we had the outbreak of severe acute lung injury associated with e-cigarettes and vaping, also known as EVALI. Our fellows in the Emory and CDC Medical Toxicology Fellowship Program were deployed to several different states to assist in the investigation.
The first cases came from the hospital that our poison center is attached to. My colleagues and I kind of helped with our health department working with the outbreak, and we wrote some papers trying to suss out what we thought the source was. Were you directly involved with the Valley outbreak at all?
I was not involved directly. My co-fellows in their second year all got amazing firsthand experience doing some of the disease detective work in the field. I was a first-year fellow at that time.
We just missed each other.
Yeah.
Nobody remembers Ivali anymore because then COVID happened. But
exactly.
It sounds like the CDC plays an important role globally in terms of providing epidemiologic and investigative insight. How do you get notified of these outbreaks? Are you guys doing data monitoring?
So there are several ways when we can get notified. So my team works very closely with America's Poison Centers on toxicosurveillance. We are constantly on alert for unusual patterns that might pop up in the National Poison Data System, or NPDS.
NPDS, or the National Poison Data System. Poison centers track every toxic exposure in real time. Every call, every substance, and every symptom it could have created logged into a national system and used for surveillance to identify any possible outbreaks.
So sometimes we might see patterns there.
Of course, you don't need big data and algorithms to pick on an outbreak. Sometimes you just need a gut feeling.
Now, sometimes we just get notified directly. For example, you might have heard about the Diamond Shruumz products in the news recently. In June of 2024, we investigated severe illnesses associated with consumption of an edible product called Diamond Shruumz. That actually came from really astute clinicians. So I believe these were the medical toxicologists in Arizona, actually at both of the poison centers in Arizona. They took care of some of the first patients who got sick. People were showing up to the ER with muscle rigidity, clonus, and even generalized seizures after eating a chocolate bar. Those are some pretty weird symptoms to get after eating chocolate. These toxicologists suspected something was wrong, so they notified their state health department. Then the Arizona health officials called us up at CDC to say, hey, we have this cluster of people with clonus and seizures after eating a chocolate bar. What do you think?
Okay, we need to take a quick detour right here. This is another fatal mushroom poisoning outbreak, but not the kind you'd expect. This one was linked to Diamond Shruumz, chocolate bars, and edibles, products that have been popping up more and more over the last few years. It's kind of a byproduct of the hype around psilocybin and so-called functional mushrooms that, well, we honestly don't have time to unpack right now. A lot of these products are marketed as quote unquote magic mushrooms or functional mushrooms, but they don't really tell you anything about what's inside, just vague claims about the kind of experience you might have.
I can't remember the exact wording, but it says something like it's a proprietary blend of functional mushrooms that are
Right?
guaranteed to give you an experience or something really
Yeah.
vague like that, but it's strongly hinting, like wink, wink, it's going to get you high, but we're not going to say that it's going to get you high.
Despite hinting that these contain psilocybin or maybe some other compound that will help your brain, what's actually in these products can be very different. They often contain things like muscimol or research psychedelics, potent THC analogs, or even mixtures of prescription medications. But you would never know that because they're often poorly labeled or not labeled at all. And whatever compounds they're hiding behind those labels can make people seriously sick. In this case, toxicologists in Arizona noticed something wasn't right. Patients were showing up after eating these chocolate bars with severe symptoms like twitching and seizures. So they notified their health department, who ran it up to the FDA and CDC. And we realized this was a much bigger problem than just Arizona. After all was said and done, they found 180 people across the country who had become sick. About half were hospitalized, and 3 people who had consumed the chocolate bars had died. And once they figured out what was inside, it kind of makes sense.
Based on the lab testing that was done, that's been reported by FDA, there was muscimol and 4-acetoxy dimethyltryptamine, a synthetic analog of DMT. You also had pregabalin, prescription medication.
A nerve pain medication. Yeah.
And then you have kavalactones, all these substances from the kava plant that were in the mix as well.
I think this mass chocolate mushroom poisoning was a really good example of how something might look like a local outbreak, but be a much bigger problem. And involving the CDC was the only way to connect the dots and find out what was really inside of these things, which made me wonder, how do you get the CDC involved in the first place?
There are many ways to communicate with us at CDC. If you are a clinician and you suspect a potential disease outbreak of public health significance, we usually suggest that you first contact your local health department. That's actually the best place to start in most cases. Then they can take the initial steps to gather relevant information that may be important for a public health response, and then involve state and federal agencies as needed. But if you're concerned about an acute emergency that requires a rapid response, or you're not sure who to contact, CDC's Emergency Operations Center, the EOC, is available 24 hours a day, 7 days a week. The phone number is 770-488-7100, and they can help triage the request and get it over to the right team. But if you have more general information requests or non-urgent inquiries, there is also the CDC info hotline. So that number is 1-800-232-4636. CDC responds to requests from states, from tribal, local, territorial health departments, or even other federal agencies to contribute our technical expertise for public health activities. So states can request CDC support both in person and virtually. So one form of support CDC can provide is called an EpiAid. So the purpose for an EpiAid is for CDC to provide short-term epidemiologic assistance. And an EpiAid team can include an epidemic intelligence service officer. So that's a 2-year fellowship in applied epidemiology. As well as other CDC staff. Maybe one of our medical toxicology fellows could be deployed. And typically they're supervised by a CDC subject matter expert. I'll also say sometimes the idea of contacting CDC or another federal agency might feel a bit intimidating, especially if you don't know who you might be talking to on the other end. So I just like to say, please remember that we are your colleagues. Many of us at CDC are medical toxicologists ourselves. with firsthand experience working in poison centers and doing bedside consults. You'll see us at the national tox conferences, and we're active in professional organizations like AACT and ACMT. So I'm always happy to be curbsided to talk about any ideas or observations you have, even if it's not clear that there's a true public health threat.
So, what did we actually learn from all this? We learned the CDC doesn't just show up and take over an outbreak. They get called in, usually by local or state health departments, when something doesn't add up or when a cluster starts to grow into a problem that might be bigger than it first appeared. And when they do get involved, they're not working in isolation. They're part of a much larger system, working alongside clinicians, poison centers, state investigators, and agencies like the FDA to piece together what's really happening. We also saw how these outbreaks often don't start with some big, obvious signal. Sometimes it's just a few patients with a strange pattern or a gut feeling that something isn't right, and a clinician routes their concerns to the health department that then brings it up the chain to the CDC. And from there, it becomes detective work, connecting dots across states, tracing exposures, figuring out what people ate, what they were exposed to, and sometimes uncovering things that are completely unexpected, like contaminated applesauce, mislabeled mushroom products, or diethylene glycol in a cough syrup. And maybe the biggest takeaway is this. If you don't know who to call when something feels off, you might miss the chance to stop the next outbreak before it spreads. So whether you're a clinician, a toxicologist, or just someone trying to understand how these events unfold, knowing how this system works might help you in the future. Because the next outbreak isn't a question of if, it's a question of when. Hey, this is Ryan, and this is usually where I would wrap up the episode and say, see you at the next one. But I'm interrupting here to share a quick note about this episode. You heard Dr. Ye talking about CDC fellows during this episode. Let me play a clip.
Our fellows in the Emory and CDC Medical Toxicology Fellowship Program were deployed to several different states. They're the ones who do a lot of the heavy lifting behind the scenes with any public health response having to do with chemical or radiological exposures.
And I wanted to pause to talk about two things. First, you might be confused as to what a fellow is because it's kind of a niche term. But to become a medical toxicologist, or a poison doctor, as you'd say, you don't go straight into it. You first complete a residency in something like emergency medicine, pediatrics, or internal medicine, for example. And then you go on to do additional specialized training called a fellowship. That fellowship is where physicians specialize into diagnosing and managing poisonings. Now that's how you make a poison doctor. But how do you make a poison outbreak doctor? Well, some of these fellowships, like Emory universities, had partnered with the Centers for Disease Control to allow fellows to not just treat poisonings, but also respond to large-scale outbreaks. In fact, Dr. Ye commented how great of an asset that was for their medical toxicology program.
Our medical toxicology fellows definitely deserve a shout out. You know, trainees often don't get enough credit for all the work they do. Our medical toxicology fellows at CDC play a very important role in any outbreak investigation.
But unfortunately, since this podcast was recorded, that training opportunity is disappearing, alongside countless jobs in the public health sector. See, since the time of that interview being recorded, there have been significant budget cuts to our public health infrastructure. Now, medical toxicology fellowships still exist. We can still make great poison doctors. But the infrastructure that teaches people how to investigate mass poisonings, the kind that affect entire communities, is being dismantled. And at the very same time, we are seeing reduced regulation around corporations that have historically been some of the causes for the greatest mass poisonings in the world, like PFAS, lead, and oil spills. I mean, we all have detectable amounts of plastic in our blood right now. It's not because your neighbor poisoned your well. Many of our environmental poisons come from massive companies that are only regulatable by governmental policy. And as ominous as our situation is now, it's probably not going to get better at the current rate. We're seeing rollbacks in environmental protections, public health funding, and resources for the agencies tasked with preventing such mass environmental contamination in the first place. So this isn't just about one program. This is about what happens next. We're setting ourselves up for a future with more outbreaks and fewer people equipped to manage them. And that's why supporting public health infrastructure matters now more than ever. And if this kind of work matters to you, support it. Whether that's advocating for funding, paying attention to policy decisions, or simply sharing an episode on one of these mass poisonings so more people understand what's at stake. No matter what, just you being here is a step towards more people being aware of the huge impact public health can have on all of us. So thank you for taking the time to listen. We'll see you in the next episode of A Morel Dilemma. Hey everybody, Ryan with a quick interruption. This series only exists because of listeners like you. There are no sponsors, institutions, or billionaires quietly bankrolling this in the background. Just a lot of time, research, and production to bring these stories to life. And there are real costs that come with that. Editing software, sound design, website hosting, podcast hosting, advertising to get the word out, and a lot more. So if you're finding value in it, there are a few ways you can support the show. The first is to go to thepoisonlab.com/support and become a supporting member for as little as $1 a month. And for that, you are going to get access to every single episode ad-free and access to amazing bonus content. You get access to all of that by becoming a supporting member. But if you want to support the show and get something a little more tangible in return, there are 2 educational projects I've built alongside this series you should check out. The first is Poisonous Fungus Among Us. This is a short, simple, rhyming book about mushroom foraging safety. It's built for kids, families, curious foragers. It's a 7-minute read. It uses real, beautiful photographs of poisonous mushrooms and delivers scientifically accurate information in a way that rhymes. You can find it on Amazon by searching Poisonous Fungus Among Us, and it's also free on Kindle Unlimited. The second project is called Gotta Pick 'em. It is a poisonous mushroom card game designed by toxicologists who treat mushroom poisoning. It's a simple, fast-paced card game, but underneath it, you're learning how different mushroom poisons work, what organs they impact, the basics about their anatomy, antidotes we use for them, and you actually don't need to know anything about mushrooms to play. You can find out way more about it at gottapick'em.com, which is the companion blog that will teach you not only how to play, but a lot more about poisonous mushrooms. So, if you want to support independent public health storytelling like this, you can find links to all of those options in the show notes. But you don't have to pay anything to support the show. Just being here or sharing this with someone who might learn from it goes a long way. So thank you for listening. Let's get back to the show.